Welcome back to the June episode of County Connection. For this segment, we're going to be talking about a new initiative in Summit County called Communities That Care. And we have Kellen Glynn from the Healthy Futures Initiative, which is housed in Summit County Youth and Family Services. And we have Shannon Haynes, who is the Assistant Town Manager at the Town of Breckenridge. Welcome, Kellen and Shannon.
Thank you.
All right, so Communities That Care is a relatively new initiative in Summit County. People may not be familiar with it, so can you provide us some background on what this project is all about and what the goals are?
Sure. So Communities That Care is a grant that was awarded to Summit County in July of last year. And it's to work on kind of assessing the community, looking at our risk and protective factors here, and then finding different gaps that are listed in our resources that are available in our county for youth substance abuse prevention and mental health as well.
Okay, great. And so what has taken place in the initiative so far?
We've done a lot of community meetings, organization, trainings here. The process is over the entire county, kind of looking at everything that exists here. So pulling together all of the key players in the community, Shannon being one of them, a couple of other different people that kind of come from all the different sectors of the community, pulling them together to meet and discuss what our resources are and what our limitations are as well, kind of where our high needs are. And we've done a lot of different community meetings. We just had a large group community meeting on the 22nd. And so now we're looking at what our resources are here.
Excellent. So we have had youth substance abuse prevention and some mental health initiatives going back for decades probably, right? That law enforcement has been involved in, and youth and family services, and lots of different partners throughout the county. So what is different about this initiative in terms of taking us to the next level or filling in gaps?
Do you want to speak to that?
Well, and Kellen probably can answer this actually better than I can, but I'd say a lot of the things we did in the past, although many of them were evidence-based, this really puts a structure around what we're doing and how we're doing it, and has the requirements for building that coalition, that grassroots coalition, which again we've had in the past, but it was a lot more loose maybe than it is now. And I think, as Kellen mentioned, all the things that we've been doing since July, one of I think the biggest tribute to the program and the commitment of the community is the diversity within that community coalition, and probably the strength of that group to really take the initiatives that we're going to work on and move forward with them.
Okay, so kind of looking at the community from a lot of different angles and making sure we're being strategic. So who are, just as an example of all the folks who've come to the table, and I know it's a long list, but who are some examples?
Well, we have a lot of representation from the towns. We also have representation from FERC and from the rec centers in the area, from the schools, from the PD,
law
enforcement, from the hospital, from Mine Springs. So there's a lot. What a community care
community
clinic.
and community members. There's just some community members. I think there's some just professional folks from the community in there, but that I think covers the majority of the groups, different types of groups of people that are on there.
Yeah, we have faith-based and restaurant employees and managers, owners. There's a lot of different sectors. Right. Parents.
Great, and then touching lots of different demographics too, it sounds like.
Yeah, and we also have a youth coalition that's a part of it as well. So we have kids that are from Summit High School and from the Peak School that are also represented on the coalition. So that's been a really great addition, hearing from the actual youth in the community what they're being affected by.
So through this meeting of the minds, taking that strategic look at the community, what things have kind of come to light in terms of some of the risk factors that are unique to Summit County and some of the challenges that we really need to tackle here?
Well, and with one of the groups, so within the large group coalition, there's 6 work groups within those, and the data work group just recently kind of went through all of the data that's available for Summit County using a lot of different surveys that were out for the youth and for adults, and looked at all of the things that came up in both risk and protective factors. And the two that we just talked about at the community meeting and kind of voted on and thought were of most highest priority at this time to look at were low neighborhood attachment and also favorable attitudes towards the risky behavior.
So what do those mean?
So low neighborhood attachment, specifically here, we see a lot of it because this tends to be a more transient community. People are coming and going. The neighborhoods are kind of consistent of a lot of second homeowners, a lot of people that don't necessarily live here year round. So we found that there's a lot of people reporting that they don't feel very connected to their community or their neighborhood. And so that's kind of looking at helping to increase that connection, that support, that feeling that you can go to your neighbor and get help, or you even know who your neighbor is. And then the favorable attitudes towards the risky behavior is looking at how specifically here a lot of that looks like, because it's a more normalized marijuana use, it's more available, it's more common, it's legal, the attitudes and the thoughts about it being harmful are lower than in other places. And so we're looking at trying to kind of educate and maybe give a lot more information about how those attitudes influence the behavior for youth.
Right. Which is something that's not entirely surprising, being a resort community. That's something that resort communities tend to, a challenge that we often face. And when people are here and kicking back,
Right.
you're seeing that example.
I think you'd throw alcohol in there as well as a concern, and certainly there are favorable attitudes towards alcohol.
Right.
Yeah, absolutely.
You've talked about a lot of the work that's happened so far. So now that you've kind of identified some of these risk and protective factors and organized these work groups who are kind of looking at these issues from different angles, what are the next steps going forward?
So now, since we've looked at all the data and kind of found out where we need to focus our attention, we are now kind of looking at all of the resources that we do have that exist already in Summit County, and there is a lot of them. There's that's what we're finding is that there's just a lot of resources. We have really, really wonderful programs already present here. So it's looking at kind of where are those programs, what might they need help with, or is there anything that we can do as a coalition to help improve those programs, or even just get the word out about them so that more people are involved in them. And then also looking at if there's any gaps in kind of what we identified as our risk factors with the programs that we have existing. And if there are gaps there, then we can choose from a lot of different programs that are provided for by the state and through this Communities That Care program that have been evidence-based and found to be effective, and we can implement those programs with the Communities That Care process.
Excellent. So for people who are interested in the work that you're doing through the Communities That Care initiative, what would be the opportunities to get involved, and how would they do that?
So we are looking for anybody who wants to join the Communities That Care coalitions. Like I said, we have 6 different work groups that are kind of working together: the data work group, the community assessment work group, we have a youth involvement committee, we have a funding group, we have a board maintenance group, and so if anybody's involved,
so whatever your strengths are, we have a niche for you.
And a PR and media relations group too. So if there's a pull or desire to be more involved, then absolutely contact us, and we can, myself or Shannon or anybody that you know that's kind of involved in this process, and we can get you hooked up with the work group, and then we'd be happy to hear from people. I think that's the biggest thing, that this is a community-run initiative, so having active members of the community is what is really driving this.
Excellent. All right, so where can people go to learn more about Communities That Care, kind of in the broader sense statewide, as well as what's going on locally?
So the website for Communities That Care is communitiesthatcare.net. And so they can go to find out more about that whole process. It is a nation or international process that goes on. So I think just in Colorado, there's 46 communities that are doing it, but it's all over the nation and international. And then to contact us locally, you can look on the website at the county website under Healthy Futures Initiative and Communities That Care.
Excellent.
And there is a direct link for it. Mm-hmm.
All right. Well, ladies, thanks so much for coming on and sharing about all the great work that you're doing.
Mm-hmm.
And thanks for being out there in the community doing it every day.
Yeah, thank you.
Thank you
Thanks
very
for having
much.
us.
All right, we're going to take another quick break, and when we come back, we're going to talk about staying safe around Summit County's waterways during the spring runoff.